So asking about type 2 diabetes. So great question there. Again, we have some more information on that as well. So again, we don't treat any disease at all with ketones, but we give you a better energy source. But what studies have shown on people with type 2 diabetes, and we know without ketones at all, studies show that type 2 diabetes is remissible and reversible with a low-carb ketogenic diet. And those studies have been out there. Those were not Pruvit studies. They are third-party studies done by other universities and other doctors out there. However, what studies have been done out there in 2016, 2017, 18, and so on, is that exogenous ketones have shown to downregulate the amount of insulin. So if I drink my ketones and then I have a bagel, this is not a bagel, but this is a bagel, or if I have some carbohydrates, that normally without the ketones, I may release 100 units of insulin. I'm using a big number. But now that I've had the ketones in my body that are the energy source, I may now only release maybe 70 units of insulin instead of the 100 units. So what has shown, especially with a type 2 diabetic, is that I'm releasing less insulin or need less insulin when I'm digesting the carbohydrates that I'm using. So amazing studies have shown out there, and there's studies out there all the time. I have patients as well who are transitioning over to a low-carb diet. The ketones help with the craving. They help them feel fuller longer. They give them more energy, so now they're walking and using that more, and now they're seeing that the standard American diabetic diet, when they're adding the ketones in it, and these are patients of mine, they're saying, oh, I can actually go longer on fat for fuel than I was doing with the carbohydrate-based study. So if you're a type 2 diabetic, talk with your healthcare provider first. There's a lot of information out there on a low-carb diet, but the ketones don't have any sugar in them, so they're not going to interfere with a type 2 diabetic diet. But again, check with your healthcare provider first. We do have information out there that it is safe with a type 2 diabetic diet, but again, check with your healthcare provider first. Yes, Teresa, you can